Slanderous statements erupted within the halls of Parliament today.
If Parliament is not respected, we have in our standing orders, Chair, that we should invoke. Summon all these people within 7 days.
Following the failure of invited stakeholders to appear before the Senate and National Assembly health committees, who were expected to engage in dialogue with striking doctors.
They were losing over 10 people a day, mothers and children. I could not imagine that COG could fail to attend such a meeting.
The Cabinet Secretary of Health is in another function when this country is bleeding, when people are dying, when hospitals are closed.
The notable figures who failed to attend the meeting despite being invited include Health Cabinet Secretary Susan Nakhumicha, Labour Cabinet Secretary Florence Bore, National Treasury Cabinet Secretary Njogona Ndungu, Council of Governors Chairperson Anne Waiguru, Public Service Commission Chairman Ambassador Anthony Mushiri, Salaries and Remuneration Commission Chairperson Lynn Mengich, and Council of Governors Health Committee Chairman Muthomi Njuki.
The Council of Governors, who are busy running around, agreeing to everything they are being told by the executive, and that they know that health is devolved and their hospitals are closed, are not here.
It seems our governors and our CSS want to derive joy from the suffering of Kenyans. We can make a painful and emotive decision to return the health back to national government. As much as we are saying, we devolved it for posterity.
The Ministry of Health, the National Treasury, and the Salaries and Remuneration Commission (SRC) are among the stakeholders who sent representatives.
When we call cabinet secretary, we call cabinet secretaries. We are not calling permanent secretaries or directors. Those are not in our standing orders.
I want to tell the chair of the Council of Governors that she has lost my support as one of the people who firmly believe in devolution, as one of the people who actually was going to advocate on the floor of the Senate that the position taken by the COG on division of revenue is the right position. I might just switch and start supporting the Treasury position that these governors, they have no respect for any institution and they don't deserve the money they're asking us.
While disappointing, the no-show by these stakeholders did not surprise the attending medics.
We are actually not surprised at all. We would have been surprised if they turned up for this meeting.
The senators and the parliamentarians and Kenyans in general have seen the kind of arrogance, the kind of don't care attitude that you have been dealing with under the counties.
People die every day in our health hospitals, even doctors or not doctors. But at the moment, of course, there's a little bit excessive suffering, maybe not death. And one of the reasons why they're suffering is that there's no bottom line support in the medical practice in the hospital.
In response to the chaos, Senate Health Committee Chairman Jackson Mandago supported ending today's session and ordered a reconvening on May 2nd, summoning all absent individuals.
Enhance the fine for people who don't show up here. Because finding a governor 500,000 shillings we have found is very ineffective. These people are very liquid.
When your bill on the summons comes to the National Assembly, we will actually raise the figure to 5 million.
The doctors' strike, which has persisted for over a month, shows no signs of coming to an end. Kenyans' hope now lies on the efforts of the Senate and National Assembly health committees to bring an end to the standoff. Ben Kirera, K24, Nairobi.